Dear brothers and sisters going to the pilgrimage, congratulations and Assalamu alaikum wa rahmatullahi wa barakatuh. This great blessing that Allah has given you and have chosen you to go and make the Hajj. What a great blessing. Today's episode is directed to the ladies going to Hajj. Of course, the ladies have some issues and some preparations to take care of, and not just the luggage, and we're talking about the issue of period and the issues of pregnancy during Hajj. Concerning the problem of adjusting the period or the time of the menses so that the lady would sustain and maintain the state of purity or state of tahara during her ihram is very important for the ladies. And of course, my personal advice is to start to plan for this as early as possible. Of course, there are two scenarios. The first scenario is the lady who would be knowing that she will be going for Hajj a good time before getting there. So she will be going to her doctor, and of course, the first thing she should do is to do a pregnancy test. If she's married, she should have the pregnancy test. Make sure that there is no pregnancy, because we cannot take the drugs or the pills if she's pregnant. Of course, she would get a course of pills or contraceptive pills that would postpone or adjust the timing of the period so that when it comes, it would not interfere with the time of her ihram. The other scenario for the ladies who are getting the visa late or getting very late to Saudi Arabia to have the Hajj, and they only have a short time, and the time of their period coincides with the time where they should be maintaining their ihram. And of course, for these ladies, we take what the lay people would call it the period postponing pills, or which are known as the progesterone. The ladies would take the progesterone, 5 milligrams, 3 tablets per day. Should be starting before the period starts, at least a day or two before their period starts, and they should continue to have these pills all the way until they come back safely, inshallah, to their homes. Of course, she might have some spotting even on the pills, which is called istihada, and this would not be causing the abruption of their ihram. So take care, and they should take care of the timing of the pills so that their ihram and their state of purity or purification should not be broken. One of the important things that the ladies should, as we said, should not be pregnant if they're having the long term or the long planned term before that. For the ladies who are already pregnant and going to ihram, there is no contraindication to go to Hajj while pregnant, but it's usually advisable to have this before the third trimester, meaning that it's usually better to have the Hajj before reaching the 28th week of pregnancy, because afterwards things would be a little bit harder for the lady and would cause some extra effort for her or extra burden for her. So it's advisable, if she's pregnant, that she would be in the first 2 trimesters. You should, of course, still go to your doctor and have your medical record with you when you're going to the Saudi Arabia. Should have the full medical report for you. And of course, you should, this is a very important thing, you should have a travel insurance, medical insurance, because if Allah forbids, you might have some problems with pregnancy, or maybe you might have the delivery there. Your regular insurance might not be covering this, and you would have to pay a lot for that. So make sure that you have a special travel insurance for your pregnancy. Some of the ladies should take care of especially the obese ladies, should take care of sitting in the airplane for a long time. They should have plenty of water, especially during the airplane time, because This might prevent them from having the deep venous thrombosis or the clots in the lower limbs, and they should have the stockings, the long stockings that would compress the veins in their legs, and they should not be sitting for a long time. They can walk and move in the airplane. If the lady gets some bleeding or spotting, she should immediately be going to a big hospital, not just a day case hospital or daycare hospital, a big hospital, to take care of her and give her the proper advice. May Allah bless you all, accept your Hajj and all your good deeds. Please do not forget to make dua for us here in Huda TV and our families, and come back safe inshallah until we meet you again. Assalamu alaikum wa rahmatullahi wa barakatuh.